Hello everyone, today I'm going to be presenting on acute flaccid myelitis, or AFM. AFM is a neurologic disease that affects gray matter in the spinal cord, resulting in sudden onset of weakness or paralysis in muscles and reflexes. AFM occurs primarily in children, with the average age of onset being 5 years old. AFM itself is not contagious, but the virus is believed to cause AFM may be contagious. The causes of AFM are not well understood, but many researchers suspect viral infections. There's currently no lab test available yet to diagnose patients, so diagnostic tests usually consist of an MRI to look for changes in gray matter and signs of inflammation around the spinal cord. Doctors may also take samples of cerebrospinal fluid, respiratory fluid, blood, and stool. Researchers have found a link between AFM and a virus called enterovirus D68, because many AFM patients have tested positive for this virus in their respiratory samples. So while there is a connection, no definitive link has been made and research is still ongoing. Other potential causes may include other viruses, environmental toxins, and genetic disorders. AFM is pretty rare, with about a 1 in a million incidence rate in the US. There have been 3 national outbreaks starting in 2014, and this is when the CDC started tracking and surveillance for AFM in the US. You can see a steady rise of AFM cases in this graph, but in 2020, there were only 30 confirmed cases, 6 of which were in Texas. And many researchers report this low number as being a result of social distancing from the COVID pandemic. You can see the common signs and symptoms for AFM listed here, which I won't go through just for time purposes. The more severe symptoms include respiratory failure and neurologic complications. Most children will have a fever or respiratory illness about 6 days before the onset of limb weakness, and most of these outbreaks occur in the late summer or early fall, so it may be confused with the common cold until the muscle weakness begins. And AFM is considered a medical emergency, and the family should seek medical attention immediately. There's extremely limited research and long-term studies within the AFM population. Some data suggests that it's common for the child to regain some muscle strength over time, but many never regain full function, especially in the more involved arm or leg. So with the persistence of muscle weakness and neurological complications, it's easy to see how widely a child's occupations would be impacted. There's currently no proven way to prevent or treat AFM due to the lack of research. So treatment is going to be focused on implementing early rehabilitation therapies to maximize therapeutic outcomes. PT and OT are often used to improve or compensate for extremity weakness. OT may utilize activity-based and E-stim interventions. Common medical treatments currently used include corticosteroids, intravenous immunoglobulin, and therapeutic plasma exchange. And there are currently no long-term studies of AFM, so the long-term recovery process is pretty much unknown at this time. Here are my references. Thank you for watching, and if you have any other questions, just leave them in the discussion board. Thanks.